Hello, I am Helen Caton and a Mosaic caregiver, currently the well-being coordinator for Mosaic, and I've been there for several years, and I've been a fitness specialist, personal trainer, group exercise instructor, and one of my interests is helping people with back pain or preventing back pain. The most important thing is helping with their core stabilization. So we all know someone who has suffered periods of back pain, even ourselves. You know, I would say that most of us have had that in the past or even present. So this class is a beginner core stabilization class, and I always tell people that we're only as strong as our weakest link, and a lot of times that's the stabilization of the core. So we ask our limbs to do things and not thinking about how that affects the core, or we have to be strong enough to support what our limbs do a lot of times. So this is a beginner level, and I'll teach it at a beginner level, but I will also show different progressions that you might want to do once these exercises become easy. And I've taught this class at Mosaic, and I always told the participants that if somebody walked by the class, they might think, well, they're not doing anything, or that doesn't look like they're doing anything hard. But I always reminded them that it's easy to do some of these exercises wrong, and a little bit more difficult to do them with the proper technique. So as I cue during this class, I'm really kind of picky on the technique, like where the pelvis is and how you breathe. And I think that the breath is really an important component of core stabilization. So as in a lot of, like if yoga and Pilates, the breath is a major focus, and as it is in this short class. So I would remind people to breathe through your nose and exhale through the mouth. And as you inhale, think about expanding the rib cage. So most people will expand the rib cage through the chest, but they don't expand the rib cage through the back. And sometimes that takes a little bit of practice to really feel that expansion in the back of the rib cage. And you may not feel it for the first few times you practice that, but you get better with it. So you inhale, so if we can practice a few, so you inhale and really feel that expansion, even including the back, and then exhale through the mouth. And the exhale is maybe through a pursed lip, where it's a little bit of a forceful exhale, and that helps to drive the diaphragm down deeper into that core, and it helps to stabilize while we do some of these exercises. So let's try another one. Inhale and exhale. So you can feel that diaphragm push down. So another is the pelvis. So sometimes we have a neutral pelvis. Most of the time, the neutral pelvis is the safest position for your body to be in. And in some people, that pelvis is tilted way forward. It causes more of a severe arch in that back, and that can contribute to back pain. So you will hear me cue neutral pelvis several times during the class. If you're at home, and this class can be done at home, it can be done first thing in the morning, throughout the day, in the evening. You can do it a few times a week. You can do this set of exercises every day. And again, the more you practice it, the better you feel. You may not feel some effects right after, maybe the first few times, but if you stay true to making these exercises a habit, then you will start feeling some improvements if you do have some back pain things going on. I would suggest that if you were in current back pain, you probably not do some of these exercises. It would also be a good idea to maybe talk to your primary provider to see if there'd be any reason why you shouldn't take some of these classes and some of these exercises. So that would be maybe something you should do before you start any exercise program, is to get the okay from your doctor. There are a few things that we use as props and exercise tools in this class. I have a few of them laying here. So if you have a yoga block, this helps keeps our hips, knees, and toes in alignment during some of the exercises. You can also use a pillow. I do have some like a 3 and a 5 pound dumbbell, and this is optional. So you don't have to use these in the exercises that we're going to use these in. I also have a yoga strap, and this helps with some of the stretches that we're going to be doing. You can also use a towel or a belt. And I also have a towel here, and I would say that if you know that you have, it's called forward head. It's sometimes when the head is a little bit forward of, maybe your ear should be over your shoulders, but if your head is in a constant position of being forward, sometimes when we lay on the back and lay our head against the floor, maybe there's a little bit of discomfort. It causes the head to tilt back a little bit. So it might be more comfortable to place the back of your head on a towel or something a little bit raised, like a small blanket. So, I may use this, I may not. If you feel like you have a need to put something behind your head, then feel free to use that. All right, let's go ahead and get started. And we've practiced a few breaths. So you can get comfortable. And we're gonna go ahead and lay on our back. So just roll down nice and easy. Let's practice a few of the breaths while laying on the floor or your mat. And as I'm laying here, I'm going to grab my yoga block or my pillow and place it between my knees. And that helps me get into a hip, knee, second toe alignment. So that's going to be a real important position for you to be in. And the yoga block typically will help us be in that alignment. So as you're moving up, we are going to have our pelvis in a neutral position. So the pelvis, of course, it tilts back, it tilts forward, but we want it to be in a neutral position. And neutral means you can also, the spine has natural curves. So the lower back, you might have a little bit of a space there because it might be that natural curve of the spine. So don't think that you have to press your low back into the mat to be neutral, because it's just that natural curve. So find your neutral pelvis, and then as we move up, our arms are going to be just to the side, slightly bent. So everything's going to be relaxed, and head and neck are going to be in a neutral position. And like I said, if you need to put something behind your head to help in that position, you can place it behind your head. It will elevate your head a little bit if you have that forward head position. So we can get started. Let's practice a couple of the breaths here. A couple of the breaths. And let's, again, inhale through your nose. Really feel like you're expanding the rib cage. Exhale through the mouth. And close the rib cage. Inhale. Exhale. One more, inhale. And exhale. All right, now we're going to do some elevation and suppression of the shoulders. So let's go ahead, and as we inhale, let's slide the shoulder blades up toward your ears. And as we exhale, slide those fingertips and kind of reach for the toes. And you can feel that, those ribs closing. Let's inhale. Exhale, reach toward the heels. Inhale. Exhale, reach toward the heels. One more, inhale. Exhale, reach for the heels. All right, now we're going to bring the fingertips toward the ceiling. Your elbows are going to be not locked, but straight. And we're going to really open those shoulder blades and then close them back down together. So we're going to inhale, expand that rib cage. We're going to open the shoulder blades. And exhale as we bring the shoulder blades back into the mat. Inhale. Exhale. Inhale. You might even hear my exhale, and that kind of helps me know that it's, a little bit of that forceful exhale. One more, inhale. And exhale. And then place your arms down to the side again. And thumbs up. And we're going to do like a little mini assessment of if you have any tightness in shoulders or the muscles along the side. And what I want everybody to do is take your thumbs up, and you're going to slowly reach them over your head. And if you have that full flexibility, you might be able to place your thumbs all the way to the floor. But if you were tight, if you have any tightness, sometimes as we raise the arms over the head, there'll be a point where the lower spine comes off the mat. And that shows that there's a tightness. So I want you to be able to maintain neutral. So once you know where that spot is, that you can potentially lift that lower back. That's going to be your limit. We're going to do some arm circles. So I don't want you to try to reach further than that, because it might lift that lower back off the mat. So we're going to try again with the breath. We're going to inhale, and you're going to circle as far as that range of motion will allow you, and then exhale, bring it around back to your start. Inhale. Expand the rib cage. Exhale, bring it around to the start. Inhale. Exhale. One more, inhale. Exhale, really close those ribs again. Now we're going to reverse the direction. We're going to inhale. Exhale. Inhale, take those palms up. Exhale, thumbs up. Inhale. Exhale. Last time. Inhale, expand the ribs. And exhale, close those ribs down. All right, now we're going to try to move down. Try to get that pelvis nice and warmed up. And we're going to learn what's called a brace move. And that's a combination of, kind of hard to explain, but it's pulling up the pelvic floor. And the term is called a Kegel. Women who are going through maybe some childbirth classes are pretty familiar with the term Kegel. Men, sometimes it's a little bit harder to understand what pulling up the pelvic floor is, but that's just a practice. So you just have to pull up, like you're lifting that pelvic floor up, and then it's a combination of pulling in that transverse. So first, kind of pull up the pelvic floor, and then pull in the transverse. And that's, when you hear me say that's a bracing move, that's a good practice for core stabilization. So as we learn how to brace, we're going to learn how to tilt the pelvis back. So you're going to brace, Kegel, transverse, and then press the low back. You're going to tilt that pelvis back, and then you're going to take it back up into neutral. So we're going to exhale and inhale as we take it back to neutral. Exhale. Inhale back to neutral. Exhale. Inhale back to neutral. One more. Exhale. Inhale back to neutral. Let's move back up to the head and neck for a second. This helps us to tilt the head and still remain in neutral position, because our head and neck, sometimes we're either flexing it too far forward or extending it too far back, but this will help us keep that head and neck neutral when we do some other exercises. So it's called an inhale nod. So as you inhale, you're just going to nod your head. The back of your head stays in contact with the mat, and then you exhale and take it back. This is a Pilates principle exercise in helping with neutral head and neck. So we're going to inhale, exhale, inhale, exhale. Let's do that one more time. Inhale and exhale. All right, let's move back down. We're going to remove the yoga block for a little while. And this series of exercises, it can be a warm-up to future progressions, or you can keep this series as your workout, depending on where you're at in your level of core stabilization. But this is a good warm-up or something that you can do every day. So once we're going to move down, we understand that pelvis, how it tilts neutral and posteriorly back. So let's keep it into a neutral position. And this is where you have to learn how to stabilize that pelvis as we add limb movements. And one way that we can assess that if we're rocking back and forth is we place our fingers maybe right at our hips. And if you feel rocking, you can feel that against your fingers. So this is just a little assessment tool that I like to use to have people be aware of if there's movement in that pelvis. So the first thing we're going to do is we're going to keep the pelvis neutral. We're going to lift one foot and take it back down. Inhale up, and then exhale back down. So this is maybe you can feel yourself rock side to side, so when you lift one foot you might tilt that way, but you want to really, if you brace real well, you're going to keep that, you're going to try to keep that pelvis neutral. And this is one of those, it doesn't look like I'm doing much, but it could be hard to keep that pelvis neutral. And just breathe normally. And last one. All right, this next movement is called a clamshell, and sometimes this one is a little bit harder than even the heel marching, because it's a movement where we just drop the knee out and then bring it back in, but we want to keep that pelvis nice and still. So these fingers are going to be what's telling you if your pelvis is rocking side to side. So we're going to add your breath to this movement. We're going to start with the right side, and it's going to be an inhale as we drop it out. Exhale, bring it back in. Inhale. Exhale. Inhale. Exhale. And one more, inhale. Exhale. Now if you ever get a little bit of tightness in that low back, rocking side to side will help you loosen it back up. So if you need to, anytime, just rock back and forth a few times. So let's get set and we'll try the other side. This time these two fingers are going to be what's telling us if our pelvis is rocking side to side. So we're in neutral. We're going to brace. And let's inhale, exhale, inhale, exhale, inhale, exhale. Let's try one more. Inhale, and exhale. Let's rock it side to side. All right, now we're going to get the hips going a little bit more with an external rotation of the hip and an internal rotation of the hip. So we're going to use these, use our fingers, and it looks like we're starting with a clamshell, but we're going to extend the leg. So we're going to drop one side out. As you inhale, you're going to extend it, and then as you exhale, you're going to rotate in and bring it back up into neutral. Inhale, exhale. So we're going to actually roll that hip out. Inhale, extend, exhale, bring it back in. Inhale, extend, exhale, bring it in. Let's try it one more time. Now, if you need to, you can actually just slide that leg out right on the floor. If you feel like it's okay, you can just lift that foot up just barely off the floor. All right, side to side if you need it. Let's try the other leg. Inhale, exhale, back up. Inhale, take it out. Exhale, rotate in, bring it back up. Remember, we're keeping that brace going. Inhale, exhale, inhale, exhale, and let's try it one more time. Inhale and exhale. Okay, we started that with the external rotation. Now we're going to do the same thing with the internal rotation. So we're going to go ahead and brace, and as we internally rotate, we're going to inhale and then exhale, bring it back up. Inhale, exhale, bring it back up. Inhale, really rotate from that hip. Exhale, bring it back up. Let's try it one more time. Inhale and exhale, bring it back up. Rock side to side if you need it. Let's try it on the other side. So the rotation is happening right in that hip joint. It's not necessarily I'm just turning my foot, I'm rotating from that hip. So let's inhale, exhale, inhale, exhale, inhale, exhale, and last one, inhale, and exhale, bring it back up and rock side to side. All right, we're going to learn a move called, it's a supine 90-90, and this progresses into an exercise that's called a dead bug, but you have to master the supine 90-90 before you can move forward. And the thing that's different about this move is that you move your legs to where you have a 90-degree bend in the knees. And again, that hip, knee, second toe alignment is really important here. So, and you're going to be neutral. As you raise one leg, the knee goes to straight above the hip, and you maintain that 90 degrees. So you're not coming up and extending the knee, you maintain that 90 degree, you bring it up, and then you take it back down. So here's your two fingers again, watching how much you're moving. So you're going to inhale as you start the position. So inhale, expand, brace, and then exhale as you lift, and inhale back down. Exhale, inhale, exhale, inhale,
Yeah. So are you moving? Is that pelvis moving? Okay. Good job. Okay. So right now, kind of assess. Was that easy? Was it difficult? There's something that you can do, and it turns it into a move that I call a suitcase. So you can grab a light dumbbell, and even if it's 1 pound, 2 pound, I've got a 3 pound. As you want to progress more, you can get into a heavier dumbbell. So it turns into a suitcase by, and I'll just demonstrate it without the weight. You can place your arms overhead. So remember that point where you raise it. So you start at that same point. So if you're here, the suitcase part, you're going to close the suitcase and then open the suitcase. So inhale and then exhale. Make sure that you're not moving. And if you want to grab that optional dumbbell, it creates, it's kind of hard, makes it harder to make it, keep the pelvis neutral, and it helps, you get a little bit of workout in the upper body too. So you can inhale and then exhale. So find the level that you need to be at. Maintain neutral pelvis. Keep that 90 degrees going. Make sure your knee doesn't come past, straight above the heel. Let's do one more set. And then release it. Now it's, as far as the number of reps, if you're going to be doing this at home, you can do even just as few as 4 repetitions on each side is helpful. You can probably work up to maybe 8. It doesn't take a lot of high repetitions on this. And then you'll move just kind of in that series of exercises. All right, the next important exercise is called a hip bridge, and this starts training the glutes. And there's a term that we use called gluteal amnesia, and that means when the glutes forget the purpose of what they're supposed to be doing. And the glutes are hip extenders. As people sit at a desk for a long time, we're talking decades of sitting at a desk, you tend to get weak glutes. And when the glutes cannot function the way they're supposed to, the next muscles have to do the work. So that means like the muscles in the lower back or even the hamstrings have to do the work that the glutes have to do. And that can start causing some issues in the low back. So you have to retrain the glutes and make them be that hip extender. A good exercise is called a hip bridge. So the hip bridge, in fact, you can grab your yoga block again, get that hip knee, and also even using the inner thighs a little bit to keep that yoga block in place is a little benefit. So as we do a hip bridge, let's go ahead and find that neutral position. And we're going to inhale. Let's go ahead and brace. Inhale, brace. Bend the rib cage. We're going to exhale and lift the hips. We're going to hold for 3 counts and then take it back down. So the breath of that would be inhale, exhale, lift. You can inhale, hold it, and then exhale as we lower it back down. Inhale, exhale, lift. Straight line for a short inhale, hold, and exhale, take it back down. Inhale, hold, and exhale, take it back down. Now, if you had some issues with maybe your hamstrings tightening up a little bit, that's very telling of how much your glutes are being activated. So you have to make a real effort to use those glutes when you lift. So if while you are bracing, you're doing that inhale brace, you can actually start squeezing those glutes. So let's try that a couple times. We're going to inhale brace, expand the rib cage, squeeze the glutes, and lift. Inhale, hold. Exhale, back down. Let's try that one more time. Inhale, brace, squeeze the glutes, expand the rib cage. Exhale, lift. Inhale, hold. And exhale, back down. Did you notice a difference in how much that was affecting your hamstrings? So just keep that in mind, and that will improve as your glutes get stronger. I might show you right here. Here's a progression, an optional progression. Don't feel like you have to start with this one right when you start these core stabilization exercises. And that is where we're going to extend one leg. And this is just if you feel like you're ready to try it. So we're going to inhale, exhale, lift. Inhale, hold. Now we're going to exhale, lift. Inhale, down. Exhale, lift. Inhale, down. And exhale, take it all the way down. And what you want to observe is if your hips are dropping as you're lifting the legs. So just a little bit of extra challenge on this one. Another one would be another progression. If you have one of those big stability balls, that you can put your heels on the stability ball and do that same type of lifting. And it adds that extra bit of core stabilization because that ball is not very stable. So that's another future challenge that you might want to try. So let's go ahead and remove the yoga block. And we're going to move over. Everything's been in this position. Let's go ahead and roll over and do some things for like the upper back. So let's go ahead and roll to one side. And place your elbows directly underneath the shoulders. And another point I would make is sometimes when people get into this position, they tend to just let that pelvis drop forward, which can maybe cause a little bit of discomfort right here. So just note that, and that you might want to hold more of a neutral position in that pelvis. So this is just, we're just going to open up the spine a little bit before we start doing some extension exercises. So remember when we did the inhale nod to help us remain in a neutral head and neck. So we're going to practice that inhale nod, and this is another Pilates technique. We're going to take it all the way down, and elbows and hands are at the side. And again, try to keep that neutral pelvis right here. If you have any tension in the low back right now, then you can take your legs a little bit farther apart, and that helps with that. So let's go ahead and we're just going to stay right here. We're going to inhale. I'm going to say inhale nod. So I didn't take my head down and I didn't take my head up. It was just a head. I'm opening. Think about opening the back of the neck. And then exhale back. Inhale nod. Exhale back to neutral. Inhale nod. Exhale back to neutral. One more. Inhale nod, open the back of the neck, and exhale back to neutral. So this is what we do when we start extending that upper back. So let's practice an inhale nod, and we're going to exhale as you lift the shoulders. So you may have to assist yourself in lifting with your arms. We're going to inhale, hold this position. And then exhale, take it back down. Inhale, nod. Exhale, lift. Inhale, hold the position. And exhale, take it back down. Let's try this 2 more times. Inhale, nod. Exhale, lift. Inhale, hold. And then exhale down. Last time. Inhale, nod. Exhale, lift. Inhale, hold. And exhale, take it back down. All right, we're going to go into a version of what's called a Superman. And a full Superman would be lifting both arms and both legs, which might be contraindicated for anybody that has any back issues. So we're going to do one arm and one leg. And you have to keep in mind that neutral head and neck. So let's, if you can extend right here, we're going to just start with one limb. So let's just lift one leg and the other leg. So right here, what makes it hard is when you lift sometimes, it causes that pelvis to tilt forward. So we want to keep that pelvis in neutral as you lift the leg. And of course, I'm exhaling as I lift. And then relax it. Now the arms are a little bit different technique. So on the head and neck, you're going to try to keep that head and neck nice and neutral as you lift. So I'm not keeping my head down and just moving, and I'm not picking it up and looking at the wall. I'm keeping that head and neck neutral as I lift. All right, let's put both of them together. We're going to do right arm and left leg at the same time. So kind of inhale, brace, exhale, lift, inhale down. Let's do opposite. Inhale down, inhale down, inhale down, inhale down, inhale down. Make sure that pelvis stays neutral. Inhale down, inhale down, inhale down, inhale down. We're going to do one more set. And last time. Good job. All right. Let's go ahead and move up to hands and knees. It's a quadruped position. And this looks like the same exercise we did, but it's only on hands and knees. And you kind of hear a term called a bird dog when you hear about this exercise. So let's start again, hands directly underneath the shoulders. And on this one, what makes it hard is because you are lifted. And we see this done wrong a lot of times when people lift their legs. They lift, but they tend to arch their back. So it's not a really high lift. You want to keep everything neutral. And the hips, sometimes you lift and you raise one hip. So if I had a broomstick or a yardstick as I lift, I want to keep it level and not lifted. So that's the thing about doing this exercise. So just kind of practice lifting one leg. Bring it in. Let's just try it on the other side. And you know, bracing helps with this. Lift. All right, bring it in. Practice, you know, you kind of have an awareness, and practice makes it easier. And the arms are gonna, and it's the same thing. So I'm not lifting one shoulder higher than the other. I'm keeping it neutral. So pretend there's a broomstick or a yardstick on my back. And I don't drop. I keep it nice and level. So that's what makes this exercise hard to do it
right, because most people, they're either dropping their hip or dropping their shoulder. So let's try it. You might, if you had a mirror, then that's really, or somebody to assess whether you're doing it correctly. So we're going to start with, go ahead and extend left arm, or left leg, sorry, and then right arm. So let's try that right here. One more. And bring it in. And if you need to, just release and stretch back. You can do it slower, maybe a 3 to 5 count if you need to. Let's try it on the opposite side. Brace. And last one. And if you need to release. Good job. All right, roll to the side. We are finished, and we are going to start stretching, which is very important. And this first stretch helps us, it helps separate, it's called thoracic rotation. So it helps us separate what the shoulders are doing with what the hip is doing. And over years, people lose that ability to separate their shoulders from their hips. So let's start with a yoga block. And we're going to start right to the side, right on the side. And we're going to place a knee on a yoga block or a pillow if you have that. Your arms are going to be straight out in front. If you need to, you can grab a pillow if you need to. And what I want you to do is press this knee into your pillow or your block. So you're going to keep this attached right here during this exercise. So the breath is real important here. So we're going to inhale as we bring the arm up, and you're going to follow with your eyes, and then exhale. And then inhale and exhale. So if you can, keep that knee right on the block, and your pelvis is going to keep you from rocking back. So keep that knee pressed right in. Let's try that a few more times. Inhale. Really open those shoulders. Exhale. Let's inhale as we hold it right here. And then exhale as we take it all the way back. 2 more times. Inhale. Exhale. We're going to inhale, hold this. And then exhale. 1 more time. Inhale. Exhale. Inhale, hold this. And then exhale. All right, let's just relax. Let's try it on the other side. And you can just roll over if you wanted to. Into position. Extend that lower leg. That head and neck nice and comfortable. Arms straight out. Press that leg right into that yoga block or pillow. All right, let's try it 4 times. Inhale. Exhale. Inhale, hold the position.
and exhale. Inhale, exhale, inhale, hold, and exhale. 2 more times. Inhale, exhale, inhale, hold, and exhale. Last time. Inhale, exhale, inhale, hold, and exhale. All right, good. So this is kind of a good test of how easily you're separating the shoulders from your hips, and that's real important in spine health. Let's go ahead and continue with the stretching, and you can get a towel. I'm using a strap, a belt, and we're going to put it around the arch of the foot. And you may need to bend your knee at first to get that hamstring. We're trying to stretch that hamstring, which can be tight. If you sit at a desk, this is one of those tight areas. And just do a few breaths. So let's inhale, exhale, inhale, exhale, and release. Now, if you know that you are tight right here or in any place in your body, you can hold stretches for like 15 to 30 seconds and release, and then repeat it up to 4 repetitions on that one side. After 4, the stretching isn't quite as effective, but if you want to really improve flexibility in a certain spot, then you can focus more on that stretching. So we'll just do 1 set on each side. But keep that in mind if you really want to help that flexibility part. Okay, let's go ahead and pull. And for stretching, if I pulled, I should feel a comfortable, like just you could feel the stretch, but if I feel like the muscle shaking, then that's a little bit too far. So just take it to a point of tension and stretch, and not to that point of shaking muscle. So just find your stretch place. And let's do a couple breaths. Let's inhale, exhale, inhale, exhale. Roll to one side and push yourself up. We'll do a little bit of head and neck stretching. A lot of people hold tension maybe in the upper part of their shoulder, like the upper trapezius, and a lot of times working at the desk will aggravate this. So here's a really good stretch that I like to do to just really target this area right here. And what I want everyone to do is bend your head forward. And then I want you to rotate and look to one side. Okay, if you're looking one direction, I want you to take the other arm, the opposite arm, and place your hand right at the top of where the top of the head is. I want you to slightly push down, and you can feel that open up right there, and you might even want to reach with that hand to maybe increase the stretch. You can do this one standing up too. So you can feel that stretch. You maybe even just move it a little bit to find a place of the most stretch. And continue to breathe. Now when you release the stretch, do it in the same order that you got into the stretch. So let's look down to the floor and then extend it back up. Let's try it on the other side. Let's bend the head forward. Look off to that wall. Opposite hand. Place your hand on top of the head and just light pressure. You should feel that in your neck and in that upper trapezius. And if you need to, take that other arm and hold. Keep breathing. Okay, remove your hand, rotate your head back, and then lift it back up. All right, let's take the shoulders. We're going to take them forward, up, back, and around. Forward, up, back, and around. We're going to head look to the right or your left. Take it back to the center. Back and around. Head look to the left, or the opposite side. Keep those shoulders back and down. Back to the center, a couple more. Take a big deep breath. Blow it out. And blow it out. Okay, I'm going to show you one more stretch before we take a couple more breaths and finish. And this is a real important stretch for this muscle, this hip flexor right here. And that's, if I'm going to do one stretch, it's going to be that stretch, because that helps that pelvis get into more of a neutral position. If it's a really tight, it pulls on that pelvis and makes it come forward. So here's a really easy stretch that you can do to really target that hip flexor. So I'm going to get into a position, and you might need to like hold onto a chair or something. So you can get into a position, it's called a half kneeling. This is called half kneeling. And what I'm going to do, we talked about the pelvic tilt. So in this position, you're going to tilt. So you're going to really tilt that pelvis back to where you already feel that opening up, that hip flexor is opening up. Now, if you need a little bit, if you want a little bit deeper stretch, you can just slide a little bit forward, but that hip flexor is still being stretched. You can even make it more of a deeper stretch to affect the side of the body by placing this hand on the leg, reaching up, and then taking it, reaching it over. So this is, I'm stretching my whole side, getting really deep into that hip flexor, even along the outside of my thigh. And then, just kind of keep breathing, hold it for that 15 to 30 seconds. You can release it and repeat it up to 4 more times. All right, let's change sides on that one. Getting all wrapped up here. Okay. Half kneeling position. If you need a chair, like I said, you can grab a chair. Let's start with that pelvic tilt, posterior pelvic tilt. Feel the stretch already. Move it forward just a little bit if you need to. Hand on that thigh and reach up. And really feel that good stretch. Keep breathing.
and release, and down. All right, good job. Let's start a couple more shoulder rotations, kind of get that head and neck back. Roll the shoulders forward. Big deep breath. One more. And take a big deep breath. And roll them back. Good job. Thank you.